It's my feel-good breakfast show.
Welcome back, everybody. We are continuing our conversation on health. And of course, there are so many beautiful aspects of pregnancy, and expectant moms should get to experience all of the good things that comes with being pregnant. But with the coronavirus pandemic, it's quite understandable that women are afraid and also experiencing more uncertainty than excitement. And of course, specialist obstetrician and gynecologist Dr. Sonntag is still with us to discuss pregnancy in the COVID-19 era as we commemorate Pregnancy Awareness Week starting later this week. So thank you so much for still sticking with us. Dr. Sonntag.
Doctor, interesting times. There is not a sphere within the medical world that hasn't been affected by COVID-19. We know that it's put additional stress on our hospitals in so many areas. We were talking about how it relates with World Cancer Day last week, how that's changed that treatment dynamic. How is it affecting in terms of the work that you are doing? Are pregnant women at a greater risk, at a lesser risk of contracting COVID-19? And if they do contract COVID-19, what are the possible complications? Is there a difference in the way that you would treat a pregnant woman as opposed to a normal person, contracting the virus?
The COVID infection rates in pregnancy have actually been a lot lower in South Africa than we thought that they would be initially.
Wow.
But pregnant women are still at risk, especially in the third trimester, so over 28 weeks. There's a lot of physiological changes in the body, especially in the respiratory system. So any kind of infection that would affect the lungs would affect a pregnant woman a lot more than someone who wasn't pregnant. So I think it is a very scary time. There's a lot of anxiety around pregnancy. Women who find themselves pregnant, who maybe now would have liked to have delayed it, who are very concerned about giving birth and coming into a hospital.
Terrified of going into a hospital,
So there's a lot of anxiety around COVID. I think the important things, and what I always say to my patients, is just to keep doing what you have been doing, to hand sanitize, to wear a mask, to social distance, and to try and stay as safe as possible.
A question I want to know, are we seeing a lot more home births now during this? Because women are fearing to go into hospital, so they're choosing to give birth at home with a midwife and going that route?
Yes, there definitely seems to be an increase in that, where women are choosing to deliver at home because they think it is safer.
How will COVID-19 affect? I mean, I know it's a very dark thing to broach, so maybe we don't talk about this enough, but right now, COVID-19, how does that affect the unborn baby? I remember a story surfacing I think it was in the United Kingdom, of a baby being born with the virus. Does it increase the risk of a miscarriage, first of all? And what are the implications, the complications possibly for the unborn child?
The umbrella answer to all of those questions is we don't know enough about COVID yet, unfortunately. We're still in the beginning stages of all the studies. There does seem to be an increased incidence in early miscarriages, and we also do know that if a woman is very unwell with a high fever and has COVID, that she is more likely to have either late miscarriage or preterm delivery. Okay. We haven't seen any babies being born with COVID, so getting COVID through being pregnant, and it doesn't seem to have any effect on the fetus later on once it's born if the mother had COVID during her pregnancy.
It leads me then to my question with regards to breastfeeding. So what if the mom has COVID or had COVID and now they have to start breastfeeding? How does that then affect the baby?
We still do advise that mothers breastfeed. The benefits of breastfeeding far outweigh any risk of the baby contracting COVID. And it's quite unlikely for the mother to transmit COVID to the baby while breastfeeding. There's a lot of good antibodies and nutrition involved that is in the breast milk.
Immune system is born.
So that definitely outweighs the risk of not breastfeeding. Obviously, if a mother is very unwell in an ICU, or the baby is very unwell because of other reasons, then maybe the breastfeeding can't happen. But for the most part, we encourage moms to still breastfeed.
Thank you so much. We're going to continue this discussion. Dr. Kim Sonntag will be back for one more segment, and we are talking about pregnancy. We are putting a spotlight on Pregnancy Awareness Week, and we'd love to hear from you if you have any questions about pregnancy in this COVID-19 era, especially. Send us those questions on our social media platforms, or you can just phone us directly on 021 110 552 and do it right now.